So I'm going to start. For those of you who don't know me, I'm Frank Symons. I'm a professor in the special education program, part of the Department of Educational Psychology. What I wanted to talk to you today about was self-injurious behavior. That's my primary area of research. I've come up with a bit of an audacious title, What's Love Got to Do with It? And we'll come back to that right at the end. This is your brain. Those colored strips indicate that your brain is active. This is from a functional magnetic resonance image. Experience affects the brain. It also affects the way the brain develops. We know this from research, in this case with rodents, where if we manipulate the nature of experience during the course of brain development, one model, impoverished environments, enriched environments, and look and count at brain cells, you see differences in brain and brain development with regard to manipulating experience. That doesn't sound very radical. That's still a new concept with regard to how we think about the brain, and it's a very plastic organ, that it changes with regard to experience, and it changes over the course of development with respect to the nature of experience. For me, the answer, pardon me, how experience gets under the skin, there's two routes. One's a direct route, right? This is a cartoon, but if you're following any of this work, more and more, there's a very active area of research driven by therapeutic need to go direct the brain in the form of neuromodulation, deep brain stimulation, etc. And so what I need to do to set up and get back to what does love have to do with it, I want to walk you through Anatomy and Physiology 101 for those sensory nerves in the skin. I'll just point. So cartoon image, obviously intact body, brain, spinal cord. It's a cross-section of the spinal cord. Here's your hand, and this is a cross-section of skin. Okay, and there's a route from here to here that's very important in terms of the skin to brain. One way of thinking about the distinction between A and C is A is fast pain or sharp, and C is slow or dull. So if you were to walk out of here and trip and fall, or stub your toe or bang your knee or whatever, or break a rib like I did at the start of January, a couple things happen. One, there's an immediate, acute, ouch, that hurts. That's information going very fast up in A beta, probably an A delta as well, or an A delta rather, and probably an A beta. That later, that secondary, where you get that slow, dull ache, those are your C fibers letting you know they're not happy. Okay, and that's part of the protective aspect of pain. So, just again, a cartoon on the left, real life on the right. Maybe I can use a mouse. That strip, can you see that pointer? That strip right here in this cartoon is the epidermis. Our skin has 3 layers. The one we're concerned about is the outer layer, the epidermis. In it live little tiny fibers. Most of us think of them as free nerve endings. This is their correspondence in biology. That blue band, and we'll see this image again, and some more like it, is the epidermis, the outer layer of skin. In this image, the biology image, where the fibers have been stained green like a 1970s shag carpet, those are individual nerve fibers. Okay, so cartoon, real life biology, all right? So those are the guys that are the front end from your skin that are the relay point to get a message upstairs, all right? So I've mentioned C's, I mentioned A deltas, pain. The other specialized receptors we have for heat, for pain, I've mentioned, for cold, and for touch. There are a lot of outcomes related to sensory, emotion, and behavioral issues. If you're familiar with any of this work, or just to remind you, we know this from work Harlow conducted at Wisconsin. And one of the primary insights from Harlow's lab, this is a macaque, a baby monkey, reared in isolation. You may have seen this image if you think about Psych 101. One of the clearest indicators of the importance of touch, and the argument at the time was around about attachment, maternal attachment, infant bonding, etc. And then what role nutrition played. And he set up a series of experiments. There was no nutrition. The nutrition was behind on the maternal surrogate, but wire only. So terry cloth mother was preferred even though there was no nutritional value. And from that, an inference was made with regard to the importance of touch and tactile experience in early infant development. The translational insight from that work was about 2 generations out. A woman named Tiffany Field, she's in Florida right now, translated some of those insights into neonatal intensive care units, where for many, many years, the dominant model was bright lights, sterile, no touch. And what she was able to show, based on, she was a second generation student coming out of Harlow's lab through a postdoc, was to show that touch is essential, and in fact you get better developmental outcomes, weight gain, head circumference, some behavioral outcomes based on manipulating touch post-birth in the NICU. One of the other observations, though, out of Harlow's work, and this is small but it doesn't matter, is, I've got it underlined, is that these isolate-reared monkeys would engage in self-injury, in their terms self-directed aggression. Okay, not a lot of people paid attention to that because they were set up, these studies were set up for different reasons related to nutrition and attachment. So from isolate-reared monkeys and thinking about models of social systems and early inputs, my program of research in part, this is one slice of it, okay? So I just want to walk you through one data set and then I'll stop. Back to our friend the C fiber, right? Slow conducting, you walk faster than it transmits a signal. There it is right there, there's the cartoon. Injury does things to skin cells in the epidermis that make that active. And that it wants to fire and send a message upstairs as one of the possible pathways for where the problems are with regard to the sensory components of severe self-injury. And to do that, we use a variety of different tools and tests. The reason I care about this, in part, is that if you disrupt, again, the theme here, disrupting the signal, if you disrupt in a rodent model, in this case, the signal going in, this is one of those C fibers coming in, now that's the spinal cord. So we've gone from out here, you're right here. If you go in and cut and disrupt that circuit right there, one of the outcomes, besides creating a real mess locally in terms of lots of chemicals in the system, is you produce a rodent that all of a sudden, from normal, to start self-injuring, okay? So we've seen this twice now. We've seen it in a model, an animal model, primate, where we disrupt normative sensory experience, no lesions, and you see self-injury. Here's a model, normative, in this case, little rat, disrupt surgically at the point of entry of those fibers, you get self-injury, okay? So you might wonder, so mouse, rat, rodent, monkey, so what? What about human? Well, let me walk you through a few instances where we have natural models. Again, with the theme, disrupt sensory input, tactile sensory input. So if you're familiar at all with diabetes, particularly poorly managed diabetes, one of the first signs and cardinal features is that tingling in the extremities, usually in the feet. The reason that's happening, it's a vascular issue, but those C fibers, they're supported by the vascular, they're dying back. And as they do so, it creates a range of sensations, from unpleasant sensory tingling to excruciating burning. Okay? It's associated also with tissue breakdown and lesions. So for me, in terms of serendipity, I'd stumbled across a couple of cases. So there's a kind of an infamous case report of a 39-year-old woman, 1 year post-herpetic, so a viral infection. She, over a period of time, painlessly scratched through her skull. She couldn't self-report with any insight to why she was doing it. There's no family or personal history of any psychiatric disorder. That sensory testing, there was a lot of blunted responses, and then they sampled her skin and found an absence, or almost a complete absence, of those red fibers, right? The unmyelinated C fibers. Is there any relevance to that to think about self-injury in the children and adults that I'm interested in working with and providing support and services to when I'm wearing my basic science biology hat? And so to find out, we sample. So we sample skin. It's a little biopsy. It's painless. It does break the skin. It's treated like a little wound. And we take a little piece of skin and we put it under a microscope. So you know that. So your eye needs to look at the blue band. The blue band, the green shag, those individual nerve fibers, no fat. They're the unmyelinated C fibers, important for pain. So this is the first peek under the hood, so to speak. Skin sample, see the blue band. You don't see a lot of green. There's normal. So you put those two side by side. On your left is normal innervation. On your right, what do you see? You don't see much. You see an absence to a large degree, big spacing, minimal fibers. So it's the first sort of example of thinking, well, there may be a peripheral innervation problem that's something systemic in the wiring and the circuitry with regard to that first point of contact. Because for me, the metaphor is that self-injury is a condition in which behavior and biology meet at the skin. There's certainly context influences. I come from a behavioral, most of you in an applied behavior analysis course. My rearing is in applied behavior analysis, and so we think a lot about reinforcement mechanisms and social context, and a lot of that is regard to maintenance, but how something starts and why it maintains may be different classes of variables. So the work I've been doing on the biology side is trying to understand what might set up somebody in the first place for the vulnerability that confers the risk for something like self-injury. And so with that first look under the hood, there's a possibility that the way that the wiring is in the skin may determine a range of experience that might be a contributing factor to risk for self-injury. And so with that, I think I hit my 10. I'm going to stop, and I'm happy to take any questions.